Welcome back. We're back now with a story all new at 7, diversity in fertility. When a couple of color tries to conceive using a donated egg or sperm or both, and they would like to have a baby of their own race, they typically have fewer people to choose from in that process. But before we dig deeper into that, let's start with why more people are turning to donation options. They're starting families later in life, according to the CDC. The average age of the first-time mother in 1970 was 24 years old. 30 years later, that jumped to 27. According to the National Institutes of Health, 20% of mothers are now having their first child at 35. But with that comes the biological realities.
Every person who is born with ovaries has a biological clock. And sometime after 35, that biological clock starts to have a smaller pool of developmentally fit eggs.
And because of that, more people are turning to in vitro fertilization and using donors. The group, Co-Fertility, says 12% of all IVF cycles in the U.S. involve donated eggs. Connecticut-based fertility clinic is trying to raise awareness about the diversity among donors. They say there are many reasons why people of color don't donate.
Historically, this went on with COVID as well, that people of African ancestry in the history of the United States maybe have not been treated well, do not have a lot of trust in the medical community, and that has filtered through from generation to generation.
That's Dr. Mark Leondaris. He's a medical director at Loom Fertility, which has 4 locations here in Connecticut. He says in addition to a lack of trust, there is some trepidation about the process, which includes many screenings.
Finding an egg donor is a 2 to 3 month process. And once they find that donor has to be screened medically if they have not already been screened by a clinic. And that's going to include cross-checking the possibility that there's genetic conditions in common that exclude that donor. That donor has to pass FDA regulatory standards for infectious diseases. That donor has to pass mental health screening as per the American Society for Reproductive Medicine. That donor has to pass medical screening and willing to take the risks as defined by the guidelines of the American Society of Reproductive Medicine.
So as you can tell, there's a lot to consider to become a donor. The doctor says those thinking of donating should ask themselves certain questions, like what if the child wants to contact you in the future, and the medical risks of the procedure as well.
And they're all very low, certainly less than 1 in 100, in many cases less than 1 in 1,000. And I think the biggest questions that people struggle with is when this child is born, am I going to have an ongoing relationship with these parents and this child? And that's something to be defined. And you get to define that.
And he points out some of the benefits of donation, like getting a full medical assessment of your eggs or sperm, as well as the financial component. But he stresses anyone doing this solely for financial gain likely won't work out.
This is something that you, the person donating, has to feel good about in your heart, is important. Doing it simply for financial reasons, I think, is not the right way to do it. And often that will actually come to light when you meet with the mental health professional. It is a life-changing opportunity you have for somebody who really desperately wants to be a parent and needs your help.
And the doctor's advice for parents going through this process, regardless of race, it can be long and require compromises along the way. He encourages them to be open to changes.